AJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 4 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
And good morning. It is Wellness Wednesday for the 5th of August. I'm Kyle Wiggs, and we're going to talk. These subjects are difficult to deal with, but we're going to talk cancer, specifically lung cancer, today. And Dr. Vaibhav Verma, who's a medical oncologist, of course, with Fairmont Regional Medical Center, he's with us in the studio. And Dr. Verma, good morning to you.
Good morning, Kyle. Thanks for having me here.
We're going to discuss lung cancer, and obviously it's there are some local ties to it in terms of the coal miners and dealing with black lung through the years, and that turns into cancer a lot. But lung cancer, people may not know it. It's the most common cancer in men, and it's very common in women as well. Causing more cancer-related deaths than even breast cancer. So lung cancer is a major problem, and obviously something you deal with on a day in and day out basis. Yeah. Just start there. Talk about how prevalent lung cancer is and what are some of the causes.
Yeah, thanks. So lung cancer obviously is a big problem for the country. It's about 18% of all the cancer diagnoses, and more important than that, the fact that in spite of being 18% of all lung cancer, it's responsible for close to 30% of all lung deaths. So there's a disproportionate mortality over here. Unlike the other cancers like breast, colon, if you have a lung cancer, the chances are you're going to die of lung cancer. So every year in the United States, probably 250,000 people get diagnosed with lung cancer, and then probably 180 of them die of lung cancer. So it's a big killer. And like Kyle said, lung cancer kills more people than breast, and cervical cancer put together in women, and colon cancer in men. So obviously it's a big killer. A lot of research has been going into it. I think the chemo era started from the 60s, 70s. We have made a lot of progress, So it is a big problem for the nation, more so for West Virginia. This state has the second highest incidence of lung cancer. It's about 80 new diagnoses per 100,000 people every year, which is higher than the national, obviously. The national is around 60 diagnoses per 100,000 a year. So it continues to be a big problem for the state. There are multiple reasons for this. Coal dust hasn't necessarily been proven to be a cause, but it could definitely, contribute to it. Coal miners are exposed to radon gas when they're doing the underground thing, mining. So that's a risk. Then I don't know how prevalent smoking is, right, but that contributes to it. If you're smoking and your spouse doesn't smoke, your spouses and your kids, they are exposed to the risk. Their risk is definitely higher than somebody who doesn't smoke. Predominantly smoking is the biggest cause, and West Virginia continues to deal with it as a major problem, being the second highest state in terms of incidence.
What are some other causes? Smoking's the obvious, but you hear a lot. You hear oftentimes that someone is diagnosed with lung cancer, or unfortunately they die of lung cancer, and then the next thing you hear was they never smoked. So what are some of the other causes of lung cancer among non-smokers?
Yeah, so like I said, radon is a known cause. And then basically lung cancer is the end product of a complex interplay between what you get exposed to and what your basic genetic structure is like. So from evidence-based, the most common reason is smoking, and then radon is probably another thing. Asbestosis is another cause. But mostly, if you're not smoking, then there are reasons that are beyond our control that we can't predict at an earlier stage. So that's the unfortunate part of it.
Okay.
But yeah, smoking contributes a lot, and it helps if we cut down on that.
You mentioned radon. How prevalent is that? I mean, whenever we buy a house, the houses are tested for radon, and most people have radon detectors in their homes now.
So the thing is, underground, when you indulge in this underground mining, so in that scenario, it's very well kind of, we have evidence that that does cause to lead to cancer. But, the regular routine day-to-day radon exposure in your housing and everything, that we don't have a clear-cut evidence in terms of that. So it's really hard to say how much would it be safe and when you should start cutting down and stuff like that. So in your routine day-to-day radon, we don't have much evidence. So,
Okay.
I can't really say a lot on that.
All right, you mentioned the high mortality rate. Do I understand you're right? 80% of the people that are diagnosed, the cancer is causes death. Is that correct?
So let's just run the numbers. So currently, well, the mortality is dependent on stage. So if you're in a late stage, the chances that you'll be alive at end of 5 years is probably less than 10%. If you're an early stage cancer, the chances that you'll be alive at the end of 5 years is close to 50 to 60%, including other causes of death also. So yeah, I mean, it is definitely a high mortality cancer.
All right, let's catch it. Let's talk about how people can prevent it. And you mentioned there's new advances in terms of screening for lung cancer. What can we do?
So lately, it has been proposed that doing a low dose CAT scan annually in a certain set of population will help catch the disease earlier, and it has demonstrated that it'll cause a reduction in mortality, like a 20% reduction in mortality. So we were doing this for breast, we were doing this for colon, we were doing this for cervical cancer. For now, it's recommended we should do it for lung cancer too. Now, which is the specific population that we need to focus on? Based on the study that was done, it should be done in people between 55 to 80 years of age who have a history of a 30-pack year of smoking. Now, what a 30-pack year smoking means, it just is it's a product of if you multiply the pack of cigarettes you smoke in a day by the number of years you've smoked, so that gives you a pack per year number. So if you smoked a pack a day and you smoked it for 30 years, that makes you 30 pack per year. Let's say you smoke 2 packs a day and you did that for 15 years, it's again going to make it 30 pack years. So if you've done that and you're between 55 and 80 years of age, you should get a yearly low dose CAT scan. The risk of getting a low dose CAT scan because of the radiation that you receive is vanishingly small. But it does help catch lung cancer early and does help reduce mortality. Also in West Virginia, if I'm not wrong, about 17% of people, 17 to 18% of people are diagnosed in early stage, whereas like in the late stage it's close to 80%. And there's a disproportionate mortality. If you're in the late stage, the chances you're going to survive long is less. So it makes all sense to do screening based on what the specific population that I talked about, and it's actually recommended. So if you out there, if most likely your primary care physician is going to recommend that, but if not, just bring it to the attention so that you get screened for it.
All right. So we've screened for years for breast cancer. Ladies get an annual checkup, mammogram. Obviously, that's been going on, and there's been a push on in the last 10 years to have men screened for colon cancer. So this is the next one. This is the one that needs to have emphasis put on it to get screened for lung cancer, catch it early, and the survivability rate is exponentially higher. Is that the only way to get screened, to go through that low dose CAT scan?
Yeah, that's the best way. The other ways are to do that have been tested in the past is chest X-ray and something called sputum cytology. They are not as good. So now it's proven that the low-dose CAT scan is the best way. It's the way to go. That's what we should do.
All right. We are with Dr. Vaibhav Verma. He's a medical oncologist with the Fairmont Regional Medical Center. What does your facility provide? Again, why should people come to your facility to get screened?
Yeah, that's a good. Well, not even for screening. I would say even for treatment.
Right.
One of the major important points in treatment of lung cancer, or any cancer for that matter, is that it's an interdisciplinary subject. We have under one roof over there very good surgeons. We have medical oncology, which like I work in that department, and then we have radiology, pathology. So we have everything under one roof. So and we work with each other in perfect harmony. So you don't have to go here and there. Come at one place and everything will be taken care of. It's a high volume center. We've dealt with a lot of lung cancers, so that brings in a lot of experience and expertise. So we are confident we can take care of you under one roof. It's a smaller and a more personal setting. So yeah, I mean, these are all the reasons for you to come to Fairmont Regional Medical Center for treatment.
Fairmont Regional Medical Center, that's the place we encourage you, as Dr. Verma said, start early, get screened, get your treatment, see a specialist such as Dr. Verma, medical oncologist. You can do it all at Fairmont Regional Medical Center. When we come back, we're going to talk about the symptoms. How can you tell? How can you head something like this off? We'll talk about the early symptoms of a possible problem with lung cancer. That's when we return. Stay with us. Ask the Experts. Wellness Wednesday continues on WAJR and the AJR News Network after this.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Wellness Wednesday for August the 5th, 2015. Dr. Vaibhav Verma with us. He's a medical oncologist from Fairmont Regional Medical Center. We're talking about lung cancer and the ways to head this off. And obviously, Dr. Verma, I'm sure the first things first, don't smoke. If you're a smoker, stop. I mean, that's the leading cause of lung cancer. There's no doubt about that. One thing that amazed me is, doing a little bit of research, I found out that a quarter of the people, up to 25% of the people who get lung cancer don't have symptoms. And that's hard for me to comprehend, because if there's something wrong with your lungs, you would think that it would affect your breathing. And that's something that if your breathing's effective, go find out what that's about. Just kind of talk about that and how difficult lung cancer is to detect.
Yeah, that's true. The symptoms for lung cancer are pretty vague and non-specific, if you will. It could be cough, it could be a persistent cough, blood and sputum, recurrent pneumonias. So, all of these things can happen with so many other things. So it's hard to put a finger on lung cancer if you have these symptoms. But definitely, if you've been a long-term smoker, then all of these symptoms are concerning. And like Kyle said, 25% really do not present with anything. The reason is that, definitely it could present with a difficulty breathing, considering it's in the lung. But then a cancer doesn't have to be as big to involve your whole lung for it to be of concern. You could have like a 4-centimeter thing sitting in your lung, which is still as concerning, but it probably would not cause symptoms because it's just a 4-centimeter thing sitting in a big lung. But still, it could cause coughing, bleeding, all of those symptoms. So that's why screening, I'm going to reiterate, screening is a very helpful thing that we should all kind of spread the news around and have everybody do it. It's a good thing because it's so hard to catch lung cancer based just on symptoms. But if you're a smoker and if you have persistent cough and recurrent pneumonias, you should probably bring it to your doctor's attention.
People might, if you're a lifelong smoker and you smoke a lot, you're gonna cough a lot. People might think that that's just part of being a smoker.
That's where the dilemma comes in. So that's why the screening is helpful. Yeah. And
in terms of the treatment, what's that like? What are your options? Now, obviously, it depends on the time. If it's early stage or later stage, what are the treatments that are available for people who have lung cancer?
Yeah, so one thing interesting about lung cancer is that in past 5-10 years, we've come up with molecular targeted treatment. So traditionally, from like 60s and 70s, we were treating with chemotherapy, and we still do it now. They're pretty powerful drugs, and they still are the backbone. But then we have these drugs which, based on what kind of mutations you have, the mutations are like genetic alterations in your basic DNA makeup. So if you have certain kind of mutations, then you become eligible for these new drugs, which are oral pills. They're not chemo, so they're like very non-traditional in that sense. They don't have any side effects, as many side effects. Sure, they do have some, but they're manageable. And they have a terrific response. So if you are eligible for a new, one of these drugs, they have seen that your survival, your response rate, everything is almost doubles up as compared to if you don't have them, those kind of mutations. So that's very interesting. It has changed the kind of landscape of how we treat cancer. But again, all of this is in context of a disease that has really spread, and that's like not local anymore. But if you have a local disease, the best bet is to get it out as soon as you can, and hopefully get the whole thing out. And then some people need further chemotherapy, and some if it's a small enough tumor, just surgery would do.
Mm-hmm.
So yeah, it's exciting times for lung cancer because of all of these new treatments. And one more thing I wanted to point out: a lot of people, think that my cancer is already spread. I'm not going to live long. Why should I take chemo? Because it's going to make me feel bad. And I'd rather live my last months or couple of years, without the burden of chemo. So the thing, it's really been shown. I'm talking about medical evidence here, that if you get chemo in that setting, in an advanced setting, we try to prolong your life. It definitely also improves your quality of life. So, if you have cancer everywhere, it's going to make you symptomatic. The treatment shrinks it down, and in addition to giving you a longer life, it also gives you better quality of life.
Mm-hmm.
And so that's something that I wanted to get across.
You mentioned the mutations and
Mm-hmm.
the genetic. You look at the genetics of a person that has cancer, and obviously some are more treatable than others. How do you determine that? Is that done by a simple blood test?
No, so when they do a biopsy, that's how we diagnose in the first place. So when we get a tissue, the pathologist runs tests on them, and that's how they're able to. So it's not a blood test, but it's from the tissue specimen that we get.
Okay.
Yeah.
Very good. And treatments, it's exciting for you. How long have you been involved in this?
It's my 4th year, and obviously it had come around before I started, but still, it's relatively new in terms of, the total time that we've been treating cancers. It's last 5, 6, 7 years that it's been around, and it's really promising.
And as you've studied this, is lung cancer among the cancers that are on the rise? Is it more prevalent?
It's kind of plateauing off as terms of incidence is concerned. I think a lot of that has to do with the fact that smoking, the serious level of smoking, which is more than a pack, I think it's more than half a pack a day, that level of smoking is coming down gradually. So I think that might have to do with it. But yeah, it's kind of plateauing off.
So the word is getting out in terms of...
Definitely, I think so, yeah.
In terms of, obviously, smoking is something that...
Yes.
It leads to a lot of different cancers, not just lung cancer.
Exactly, that's true.
If you can keep people from smoking or have them smoke less, obviously that's a very difficult situation, difficult habit to break. But in West Virginia, it's very prevalent. So, in terms of treatment of lung cancer, again, Fairmont Medical Regional Center, as you said, it's kind of a one-stop.
Yes.
Place.
Yes.
And you encourage people to come in and get screened. That's where you start, right?
Yep, exactly.
All right, so check out Fairmont Regional Medical Center. We encourage that, obviously, and Dr. Vaibhav Verma has been our guest. He's a medical oncologist and an expert on many cancers, but we focused in on lung cancer today, talking about the symptoms, talking about new treatments that have been in place just the last few years. And obviously lung cancer and cancer overall, something that affects many, many people, and everybody knows somebody who's been affected with it. So Dr. Verma, we appreciate your time and your insight.
Thanks
for
having
coming
me
out.
Yeah.
And again, this has been Wellness Wednesday as we talk about the treatment of cancer, specifically lung cancer, with Dr. Vaibhav Verma, medical oncologist from Fairmont Medical Center. That's it for Wellness Wednesday. Thanks for listening on WAJR.